For patients that have had surgery, they can expect the following from a recovery standpoint. If they've had open surgery, typically it's an incision that's made either on their side or in their midsection. Often the patients will be in the hospital for a few nights. Typically, they'll be able to eat and drink right away, but often will need to be supported with IV fluids and pain medicine for several days following surgery. They'll often have a catheter in their bladder and occasionally will have a drain. They will be expected, however, to go home with no additional tubes. Usually no drains or catheters are required. For patients that have had robotic or laparoscopic surgery, recovery time may be slightly shortened. They may be in the hospital only for one night and occasionally even go home the same day. But most patients will remain in the hospital at least overnight, and often will have the same tubes that I listed before: a catheter, usually overnight, and a drain plus or minus, depending on the extent of the surgery. In terms of pain and other side effects after surgery, again, this boils down to the size and extent of their incision. Most patients will require some degree of pain medicine in the hospital and often for a few days afterward, but the majority of patients following kidney surgery are off all narcotics after about 3 or 4 days. There will be a period of time where they will need additional support, such as stool softeners, because often they will get constipated following surgery. And occasionally, some patients will need prolonged narcotics, especially if they've had a large incision or they're very susceptible to pain. The pathology report after surgery in kidney cancer can be unique. Kidney cancer is not one entity, but is comprised of many, many subtypes. Several of the common subtypes are relatively straightforward to diagnose to make and often can be made within 5 to 7 days. Other diagnoses, however, require additional stains and occasionally molecular sequencing, which can make the diagnosis take up to 2 to 3 weeks to come back. Patients will often be alarmed at this, but I often tell them that this does not mean that the cancer is more aggressive. It just means it's more uncommon, and we need to be precise with our diagnosis. In terms of how the diagnosis may affect the patient's treatment strategies, we do know that if patients have had localized disease but have very aggressive tumors, we often may recommend additional treatment strategies, usually in the form of immunotherapy, to be given following surgery. So the pathology is important for that. It is also important in terms of how often they get imaged following surgery. Again, low-risk tumors or benign tumors can have very few imaging studies performed, whereas high-risk tumors may need imaging every 3 to 6 months. So if you've had a full kidney removed or even a partial nephrectomy occasionally, you will see a decline in your renal function, your kidney function overall. Most patients, however, do not need to make major lifestyle modifications. We know that people can give kidneys to friends if they need them for a kidney transplant, and those patients often live full and healthy lives. However, many patients with kidney cancer will have underlying medical issues to begin with and may not have the greatest kidney function to start with. For some of those patients, they may have a real significant decline in kidney function, and they may need to adjust their medications and or their diet. For those patients, we often will refer them to see a nephrology team that is a renal medical doctor, and they can often help with them with adjusting their medications, supplements, and diet. If we remove a whole kidney, it can affect your life expectancy. In general, if you're young and healthy, most patients will live a full life without an impairment in their overall life expectancy. However, if you are a patient that has underlying chronic kidney disease and or other comorbidities such as heart failure requiring diuretics or other significant medical issues, having a whole kidney can impact your overall life expectancy, which is why we can, whenever possible, try to do partial nephrectomies to preserve renal function, because we know it is a direct surrogate for overall mortality.